I was planning a 7-minute introduction for the next speaker, but in order to get us back on time again, I will keep it short. He's a CHP and has a master's from Harvard and a fellow of the Health Physics Society. His company, Moeller, is well known to this audience and doesn't need any introduction. So as CEO and chairman of the board, I believe Matt Moeller is in a great position to discuss his topic, the business of health physics, jobs in a changing market.
Thank you. Thank you, Chad. Indeed, it's an honor to be here at the NCRP annual meeting. I'm very grateful to the program committee to invite me to speak on what I call the business of health physics. Other than being a second-generation health physicist, you may ask, well, what's my pedigree in order to comment on this topic? I share with you that my first 10 years were post 3 Mile Island at PNNL out in the Pacific Northwest, followed by 5 years at a very dynamic consulting company, SAIC. And then I know it's hard to believe, for nearly the last 22 years, directing and managing the operations of Moeller & Associates with so many wonderful colleagues. So the purpose of my talk, as I've titled it, Jobs in a Changing Market, is to provide perspectives on our profession in terms of the economics of jobs. And I'll very quickly point out what I'm not going to do. I'm not going to talk about academia. While Dade could have done that, I really can't. I'm not going to talk about government jobs. I'm not going to talk about those that exist within big companies on some of the very, very large projects. What I am going to talk to you about is that small little niche market that we call consulting, where we're providing services to others in order to make their operations more efficient, in compliance, safer, and more reliable. These are the perspectives of a relatively small business. Our business over the years has ranged from about 25 million to over 50 million, with upwards of 300 employees at our height when we were doing a major project in the Gulf in response to Deepwater Horizons. And I hope to come back to that because I hope all of you are asking, well, how did a health physics company end up supporting so much work in response to an oil spill? Today is all about relevance, and I hope to come back to that theme many, many times. So the approach, I'm going to break this down into 3 pieces, and I hope you'll have the patience for me on each part. I hope I don't go too fast or too slowly through them, and I hope you'll realize that you will indulge me with a little bit of history. Again, being a second-generation health physicist, I am in tune to the history of our profession. And I want to do that not just because it's fun, but because it gives us a perspective on and a context for where the jobs came from. Next, we're going to turn to the data of jobs. We're going to do that in terms of membership of the Health Physics Society, and we're also going to do that in terms of the revenues and operations of our company, which is, while one very small sample size, I hope will give you some interesting insights. Lastly, I'm going to analyze where we are, where we need to go, and give you some specific recommendations for what I think our profession needs to do in order to preserve the science. I know you've seen a lot of the same slides at times for good reasons. I don't believe you've ever seen this slide. I hand drew this. You'll notice at the bottom it says estimates, and the reason it's estimates, even though the data from about 93 to 94 is as close as my steady hand would try to draw, that appearing before those years is based on some research I did on some papers that were written about membership in the Health Physics Society on the 50th anniversary, as well as information on the early years. You'll notice the relatively flat line. I think it's quite telling that for about the first 50 years after the discovery of radioactivity, there really were no full-time health physicists. There were none. Well, there was one, but we'll talk about him in a moment. You'll see that very steep slope. We're going to talk about that, and then we're going to talk about the rise and the fall. I invite you to consider whether that green triangle is going up or down. I think that's why we're here today. One final thought on this slide is, in the big picture of a science timeline, is this a blip? Is it a blip? Is our profession going to come, and will it end? or what indeed is the rest of that curve? So let's jump into the fun part. No. I said this is all about providing jobs and context. In the early years, the radiation protection was an ancillary activity that was done in laboratories. An interesting story, we all know that Becquerel discovered radioactivity in 1896. You may not know that he kept a vial of uranium in his vest pocket, which burned him routinely, and that allowed him to start taking safety measures to not carry that vial of uranium in his vest pocket. The gentleman on the upper right is William Rollins. William Rollins is credited to be the first health physicist. He gets that designation in that he, purely for the purposes of safety, developed new and improved X-ray tubes in the early 1900s. Went a little bit too fast. I wanted to cover very quickly, again, using the timeline as a basis. In 1928, we heard yesterday, ICRP was founded. The next year, the precursor to NCRP, so 1939, AIHA was established, and it was specifically to respond to industry needs. And one of the telling pieces was it was an X-ray and radiation component of AIHA. The first written handbook, a 15-page handbook published in July 1941, right before World War II, by the National Bureau of Standards represented the first written protective measures on radiation protection. Well, what happened? Well, we all know. It was a very abrupt and powerful change. And with this change led to the birth of our profession as we know it today. I read in a quote, the once rare and precious radioactive materials suddenly became all too commonplace. And it is that common existence of radiation and radioactive materials that suddenly allowed our health physics activities to blossom on a very steep rise. In 1955, we had HPS. 1958, we had the American Board of Health Physics. We had the Cold War. We had training being conducted in Cincinnati by Dave Moeller in the mid-50s. We had the atomic energy revolution where reactors were going to be providing electricity. In the 1960s, we definitely had the growing needs. We had nuclear power plants, among others. Interestingly, in the history of the society membership, that is the Health Physics Society, there was a slowdown in the mid-60s in terms of membership. The focus at that time truly was about the number of people who were actually or potentially exposed. Throughout this time, we were also answering as a profession to the needs that were occurring, whether they were sailors on the Lucky Dragon or 3 Mile Island, Fukushima, Chernobyl, orphan sources that were left unprotected. Our profession has responded to the needs and has actually been able to ramp up with remarkable nimbleness to address these important concerns. Those concerns have also allowed research and other activities to be highly focused. So what are the current needs? I'll break this point with the beginning of the downward slope of HPS membership. In the mid-1990s, the Department of Energy began to clean up the weapons complex. It became a very different time. It was no longer the classic operations. Rather, it was the decontamination and the decommissioning of these very, very, very large facilities that necessitated very, very large companies becoming involved. These large companies do certain things really well. They do big business real well. And it was, in many cases, about the money and how money was spent. So let's back up just a little bit, only for the purpose of looking at the early needs and how those needs came about and how those needs helped establish some of the specialties within our profession. We see needs of the expanding nuclear weapons that I mentioned, the Cold War testing, the nuclear navy, medicine, industrial devices, and other applications, as you can see. So from that, jobs were created. In each case, you can almost make a one-to-one correlation between the type of job that was established and the mission or purpose for which that job was applied, and as part of a very dynamic and an exciting period of time. So from a current perspective, some things have changed. I say conducting research. After listening to yesterday, I should put that in perhaps in smaller letters, as less research is being conducted. But we are, in fact, in today's world, and again as a consulting company, responding to these various activities. I think without question, just to put a stamp on this end of part one, it is without question, while all of the details of low-dose exposures and other research may not be known, it is without question the general consensus of all health physicists that no exposure should be incurred without a benefit and a commensurate benefit associated with that exposure. So let's jump into part two. It's graph time. I hope these show up. My pie charts. First one is on the membership of HPS. I did a little data management. I removed the other. I did some consolidation. I did a 15-year average. Interestingly enough, it really doesn't change when you average it. And you come up with more than a quarter of HPS members are within the government, and you can see on down to university. You'll see our little piece is consulting, about 11%, which again means that what I provide is a very limited perspective on the big picture. But I hope you'll agree. I also think from this slide you might erroneously assume that we like to think of ourselves as generalists. That as health physicists, we can do just about anything. Well, then you get into the HPS specialties. For whatever reason, we are really unhappy as scientists being identified with others. So we need to break this down and break it further down and break it down into another layer and then a little bit more. And suddenly we're seeing what we heard about yesterday, which is a little bit of the stovepiping of different specialties, a little bit of the loss of that interaction, which was prevalent in the early days of our society and in the early applications. So what I did is I cheated. I always cheat. I broke this down. I took all those specialties and I consolidated them into a manageable number, and I made certain assumptions, and suddenly I ended up with a pie chart that I thought was a little easier to decipher. And the bottom line is that about a little more than 50% of those in the Health Physics Society are working what I call boots on the ground, whether it's applied health physics or reactors, fuel cycle, waste management, and the like. And you can see on the slide some of the other areas. I think very significantly, as I mentioned, the 50% is the boots on the ground. When you go back to the original activities of our profession, the reality was that most of our earlier health physicists were in the field. I think today, and maybe it's with the advent of computers and the ease of a lot of desk applications, a lot of our colleagues are in the office. And I think part of the nature of health physics has become more office HPs. So let's put these jobs in some other kind of perspective. Now again, these are my thoughts. You may disagree. You may have different perspectives. That's a great thing because you see some downward arrows. My opinion is that applied health physics the opportunities are decreasing. I think when we look at membership and we look at some of the causes for that, which we'll do in a moment, the number of jobs available, particularly to certified health physicists in the applied applications, is decreasing. From reactors and fuel cycle and waste, I probably shouldn't have put those in a single bin, because in terms of waste, the vitrification plant at Hanford is going to generate jobs, and yet, as we know in the US, the new reactors are replacing those that are being phased out, so there's really not any real net gain. Medical applications, I think, is growing. We saw the graph yesterday of jobs in medical physics going up, and you can see my other thoughts related. I do think environmental monitoring will stay strong and likely grow. The long-term stewardship of Department of Energy sites in particular is going to necessitate a very long-term plan to manage those cleaned up sites. Okay, shift gears once more. Very small sample size, just our company. Where do we get our revenues? We get our revenues, about a third of them from the Department of Energy, a little less than 30% from our dose reconstruction project. Environmental is very strong. We have a medical physics arm of the company, which represents about 10% of our operations, and then you can see the rest. I think what's important here is it's a good comparison to the revenues, is that when you get on the commercial side, you end up with relatively small projects that are, a large number of very, very small projects. You can generate your revenues in these type of projects, but the reality is that each particular job may be relatively small, which goes back to the emphasis on major opportunities, whether they be in the Department of Energy or with NIOSH on the dose reconstruction project or elsewhere. Simplistically, government spending is critical. We heard that yesterday related to the laboratories, or sorry, the labs and academia. It's also the case with our work. So how do these compare to real jobs, actually taking it to numbers of people? Interestingly, the dose reconstruction project provides us with our greatest number of jobs, and those jobs range all the way from data entry all the way to the very senior certified health physicists doing technical basis documents and other activities. Where do I think those jobs are going? I think dose reconstruction is basically steady state, and that is that the number of claimants coming in under YOIPA is about the same as what we're processing each month. I think Department of Energy work is going to be going down as the different sites are cleaned up. I will put an asterisk there, though, that by 2019, some $70 billion will be contracted within the Department of Energy, Richland Operations, and Office of River Protection. So obviously significant numbers. Again, focus on environmental and even more focus on medical. So let's put a exclamation point on the end of part 2. What are my observations? Observations are that health physics has changed, will continue to change. We will be responding to significant events, whether it's a Fukushima or a 3 Mile Island, or had the Brussels bombers in their shopping carts or luggage carts, had they been rolling radioactive materials, we might not be sitting here as comfortably today. In fact, we might be in Europe today. A lot can happen, a lot can change the marketplace very, very rapidly. I don't particularly believe that technology will decrease the total demand for jobs. I do think there's a danger, and I slightly digress, is that compared to what we had years ago, our meters are becoming so smart that at times I think they're more capable perhaps than the individuals who hold them. And I think that is something that is of concern, and in fact, we may get to that. So let's go into part 3. Part 3 begins with the statement that the profession of health physics has done a remarkable job, an amazing job through the years of controlling and limiting radiation doses. And I find it kind of ironic that because that job has been done so well, because we are able to measure and quantify radioactive materials and radiation doses so quickly, in fact, we are working ourselves out of a job to a certain extent. Factors affecting supply. How would this slide have been written in the 1950s? Programs weren't developed, operations certainly weren't routine. Everyone was developing procedures as fast as they could. Radiation protection was blossoming and blooming as new practices, different practices were working. What's interesting is that today, when routine operations are so much the norm, 99.9999% of the time, unfortunately, when something bad happens today, it often can shut a facility down for a really long period of time, like WIP. One has to wonder, is there an opportunity to have intellectual insurance, if you will, to prevent these kinds of problems from happening ahead of time? And why are we not investing in smarter people, more qualified, capable people as part of that insurance? There's no question that generalists are filling positions. And I will share with you that generalists are really happy to fill health physics positions. They're moving up. They're stepping up to the next level. They're being given more and more responsibilities than ever before. And, oh, by the way, they're getting paid better than ever before. I think there'll be a lot of resistance to overprotection of health physics jobs because many of the generalists have demonstrated an ability to be very successful in their roles. But the bottom line is health physics professionals being replaced, and interestingly enough, society is accepting the increased risk associated with health physicists being replaced. They must be, otherwise it wouldn't be happening. So let's turn our attention very briefly to other industries. What are the lessons that we can learn from those? Consider the economics that are governing the changes. How many of you are old enough, as I am, to remember a dentist actually cleaning your teeth? Do you remember those days? How many have had a dentist clean their teeth in the last 25 years, maybe? Barely, Ken. The point is that businesses adapt. Hygienists came to the forefront. The routine and normal kinds of activities, specialists were being replaced. Folks were being targeted for where their pay was commensurate with what they could deliver. Very important economic principle. Medical care is the same way. We now go into a doctor's office and we don't often see the doctor till the very end. You know, our vitals are taken by a nurse or a nurse practitioner. Our history is taken. They even make some assumptions on what may be wrong with you. Now, if it's a cough or if it's a cold, great. I'm all for seeing the less expensive person, but if I have a true serious disease or if I need somebody to connect the dots, whether it's cancer or other, I would certainly need that specialist. So here's the bottom line. How are we going to preserve the science? How are we going to, as Shaheen said, how are we going to preserve the knowledge and carry it forward? I believe first and foremost, the number one thing that needs to be done is to establish job standards, job requirements across our industry. And I will immediately caution you that one size does not fit all. Having the advantage perhaps of being in the consulting world, I see the differences in what is needed for certain applications. The core competency must be there, but the additional extras, if you will, the luxuries that are not afforded as specialties today have to be targeted and very specific. Other industries have done very well with job standards. The second is to require significant calculations, just as they are in the medical physics side, to be certified or done by a certified individual. In the engineering world, it might be a PE stamp. We need to improve regulatory drivers. There's no question that if you want to change behavior, you have to have a regulatory driver. Otherwise, there's a lot of head nodding, and in the background, a lot of things remain unchanged. No pun intended, but perhaps it was. But if you look at transportation, transportation is perhaps one of the most regulated industries in America, and it's one of the most conforming, compliant industries because of the regulatory drivers. I'm going to skip the next one and come back to that. Kathy touched on this yesterday, Kathy Higley. We need to make it essential to national security. We all accepted TSA in the airports. Doesn't get me through an airport faster, doesn't improve your life on a day-to-day basis. But collectively, we realized there was a tremendous need for TSA. We realized that the consequences of the realities of a high consequence event are truly unacceptable to society, and we accept that cost associated because it's essential to national security. Lastly, I think we need to attract the next generation. I think too much is said about what has been done in health physics and not enough about where it can go. I had a paper that I had hoped to present at the mid-year and unfortunately was unable to make it. But my thought was, what if we couple small modular reactors with desalination plants? Do you all know that 1 in 9 persons in the world does not have access to clean water? Do you know that 1 in 5 deaths of children under 5 are from waterborne diseases? Why in the world can't we be part of a global solution by providing the power sources and the health physics and the radiation protection expertise to secure these power sources to improve lives, not just here in the United States, but worldwide? We need a mission. We need a new vision that is beyond just what's being done today. And I look forward to others having ideas. So what are your talking points when you go away and somebody says, well, what do I say to people? I think the first thing you say to people is you got to accept the economics, because the economics won't change unless we create the job standards, unless we create the regulatory drivers. We need to do a better job of capturing the favorable economics. I alluded to this earlier. I'm sure all of you have an example where some bad event could have been prevented had a more qualified individual been available and present on the job site. We need to make HPs broader. I know from my clients, I know from putting people in the workforce, we need individuals with a greater understanding of more science, not less science. They need to be knowledgeable in industrial hygiene, the basics of occupational safety. They need to have working knowledge of integrated safety management and conduct of operations, because that's what the clients want on the job sites. And then lastly, we need to get aggressive. We need to quit giving up jobs. We need to start figuring out how to educate our future health physicists and current health physicists to not just do their job, but be able to rise up in organizations and even, as I say, capture or take someone else's job. So with that, I'll end and say thank you very much. My contact information is here. I look forward to questions. Thank you.